Well, thanks very much. I did have a significant career change in 1992 when I applied to be an astronaut and I left Sunnybrook. What's remarkable about that is we had 5,300 applicants apply and they picked 4 of us. It sounds very impressive, but then you have to realize that we had 600 applications from kids less than 10 years of age. So, you know, it's always a good thing to go out and fulfill your dream. So I'm going to talk to you a lot about different things tonight. We'll talk about flying in space, we'll talk about healthcare, we'll talk about innovation, but really there's a couple of underlying themes that I'd like you to think about during the course of the presentation. The first is this concept of dreams, that we need to go forward in the direction of our dreams and live the life that we've imagined. We can imagine a totally different healthcare system that meets the needs of our patients throughout their lives, that empowers patients to get involved in the provision, the delivery of healthcare services to meet their own needs. And I think that's something that's really very fundamental that we have to look at in the future of healthcare. I went from being an emergency physician, where there's nothing that I have not seen one human do to another human, to flying in space and having a chance to reflect on the planet from a totally different perspective. And it's really that experience that I'd like to be able to share with you tonight in the context of working in healthcare. So emergency medicine is an incredibly demanding, high-paced environment that challenges us to think very quickly on our feet, somewhat analogous to doing spacewalks in many ways, where you have to think very quickly to be able to respond to the ever-changing challenges of traveling 25 times the speed of sound. That's 8 kilometers every second. You snap your fingers, space shuttle's gone 8 kilometers, and of course I'm attached to it, so I'm going 8 kilometers as well. But leaving this environment and thinking about the challenges that we face in healthcare today are much broader than we ever could have imagined. I trained at McGill in medicine from 1979 to 1983. The breadth of capabilities, services, innovative technologies that exist today is totally different than that which I experienced in training in medical school. And how do we train healthcare professionals to work in today's demanding healthcare environment? Something very fundamental. We have significant challenges that we're going to be facing over the next 20 years. Medical error is a $19.5 billion problem annually in the United States, according to a study done by the Society of Actuaries. If you extrapolate this to a 20-year horizon, $390 billion will be spent on medical error. Sounds like we have an opportunity to improve and use the healthcare resources that we have available in a more efficient manner. If we look at the problem of chronic disease, there are 5 chronic diseases that will cost us $47 trillion globally over the next 20 years. These are daunting numbers. I mean, I look at this and say, what are we going to do to find a solution to the problem? And the interesting challenge of negotiating our way through this maze is that many of us would simply look at these numbers and say, it's impossible. We cannot do it. It's beyond our scope to be able to find a solution. And I'm here to share with you that there's one word that I no longer use in my vocabulary, and it's the impossible word. I've traveled 25 times the speed of sound. And I look at the possibility of traveling faster than the speed of light, and I used to challenge people to think that it's possible, and people would tell me, no, it's impossible. You must not know, you must be a life scientist, right? And now, of course, recently we've discovered that perhaps that impossible barrier may be possible to break. So impossible, get rid of it. Under what circumstances can we imagine a model of healthcare where we're not spending $47 trillion in managing chronic disease, where medical error is a problem that once existed that we've got our arms around? So I think the solution is achievable. We just need a new model to be able to go forward and achieve it.